Hi, my name is John Lackey, representing Team 628 with the Utah Tonsil Clamp. Our team includes Scott Andrewarden, Shady Brown, Brianna Lackey, and myself. We are all students in the Department of Bioengineering at the University of Utah. Each year, there are more than 700,000 tonsillectomies performed in the United States, making it one of the most common pediatric surgical procedures. Tonsillectomies are typically performed to treat recurring infections or, more recently, obstructive sleep disorders. Of these patients who undergo tonsillectomies, about 5% or 40,000 will experience post-tonsillectomy hemorrhaging or bleeding. These bleeds can range from mild ones that require a trip to the ER for treatment and observation, or severe bleeds that can be fatal. There is currently no device designed for this specific problem, and as such, there is a large need for such a device. Our solution to this is the Utah Tonsil Clamp, a device designed specifically to treat post-tonsillectomy bleeds. It is inserted into the oral cavity and applies pressure to the site of bleeding. It includes a unique tonsillar interface that is designed to stop bleeding without a risk of exacerbating bleeding, a skin interface that allows the device to rest comfortably on the jaw or cheek of the patient, and an ergonomic handle design that results in an easy-to-use device. Current solutions to this problem include silver nitrate, sutures, and electrocautery provided by industry leaders such as Medtronic and Olympus. Silver nitrate is relatively cheap, but can be very painful to use and is difficult to use on non-compliant patients. In addition, it can require an extended observation period in the emergency room. On the other hand, sutures and electrocautery are much more effective at controlling bleeding. However, these treatments require a trip to the operating room, a trained surgeon, and general anesthesia, all of which increase the cost to both the hospital and the patient. The Utah Tonsil Clamp avoids all of these problems. It is a simple-to-use device that does not require a trip to the operating room, can be used by most clinicians, and does not cause severe pain to the patient. Our target market for this device is the 5,000 emergency rooms and 10,000 urgent care clinics across the United States, with the goal of supplying at least a few of our devices to each of these locations. Studies have shown that treatments for post-tonsillectomy bleeding add about $2,600 to the cost of the procedure. At a price point of $100, the Utah Tonsil Clamp is an affordable alternative designed specifically for this problem that can avoid the increased time and cost that a trip to the OR requires. The bench testing has shown that the Utah Tonsil Clamp can quickly control high volume bleeding. In addition, survey of doctors from across the country have shown that there is a need for this device, and our device is a much needed improvement. By providing a solution to post-tonsillectomy bleeds, the Utah Tonsil Clamp will save time, money, and lives.